Hi, my name is Aaron, and this is my presentation on anti-cancer living in the mix of six. The mix of six is just another term coined by the authors for the 6 pillars of health and wellness. The 6 pillars are evidence-based lifestyle factors that can help prevent cancer and improve survival. They show that health isn't just about treatment, but it's about how we live every day. Small changes equals powerful results through synergy. The 6 pillars are social support, stress management, quality sleep, physical activity, healthy eating, and avoiding environmental toxins. These 6 areas are interconnected. Improvements in one, like exercise, often enhances others, such as sleep or stress. The authors call this synergy. This synergy is just a reference to these lifestyle choices working together to create an internal environment where the body can heal and thrive. Love and social support. Strong relationships reduce stress and inflammation. Social isolation increases disease risk. And community, love, and belonging equal essential medicine. Social support is referred to as the foundations of health by the authors. Research shows that patients with strong support networks have better outcomes and survive longer. As a physical therapist, I can encourage family involvement in recovery and foster a caring, community-oriented clinic environment. This is not limited to family. Friends are also welcome and highly recommended. Stress and resilience. Chronic stress fuels inflammation and weakens the immune system. Practices such as mindfulness, yoga, therapy, and gratitude can all be used to help reduce some of those stresses. And goal is to respond differently, not necessarily to eliminate all stress. Chronic stress activates inflammation that can fuel disease. Practices again like mindfulness and meditation can go a long way in building resilience and decreasing stress levels. In my future PT practice, I can use brief breathing and relaxation exercises both at home and during sessions to help patients manage stress while recovering. Rest and recovery. Sleep restores hormones and repairs DNA. Lack of sleep increases cancer risk. And then the tips just be having a consistent bedtime, limiting caffeine throughout the day, and having a calm nighttime routine like reading a book or just staying off your phone in general. Sleep isn't optional. It's how the body repairs itself. Poor sleep disrupts hormones and immune functions. Teaching patients good sleep hygiene and emphasizing rest as part of recovery can significantly improve healing. Moving for wellness. Exercise reduces cancer risk and recurrence. It regulates hormones, enhances immunity, and lifts your mood. Even light activity like walking, gardening, or just moving around, it matters. Physical activity is the heart of physical therapy. Movement helps regulate hormones, boosts mood, and improves the immune function. My role is to guide patients towards regular, enjoyable movement suited to their ability, because consistent activity is one of the strongest anti-cancer habits. Food as medicine. 90% whole, unprocessed plant-based foods are good for you. Limit processed foods, red meat, alcohol, and refined sugar. Food choices can turn off harmful genes. The authors show that food directly affects gene expression, turning disease promoting genes off and protective ones on. It encourages They encourage a mostly plant-based diet, and mindful eating supports healing. It can reinforce these habits and refer patients or I can reinforce these habits and refer patients to registered dietitians for more personalized nutrition guidance. Avoiding environmental toxins. Everyday exposures like of plastics, pesticides, and chemicals are not good for the body. Use non-toxic cleaners, glass cleaners, and filtered water in your everyday lives, and advocate for cleaner air, food, and water. We are surrounded by thousands of industrial chemicals, many untested for safety. We can't eliminate exposure entirely, but we can make smarter choices like avoiding plastics, using safer products, and advocating for community level environmental health reforms. Reflecting on my PT approach, promoting individual health, we can integrate mindfulness and movement. We can educate about rest and recovery and encourage supportive relationships. Advocating for community health can incorporate in hosting group exercise and wellness classes, support toxin-free community initiatives, and collaborate with other healthcare professionals. Based on the Anti-Cancer Living book, I plan to promote holistic health by addressing multiple pillars with each patient. On a larger scale, I can advocate for clean environments and access to wellness programs that empower communities to live healthier and more resilient lives. My closing thoughts. Lifestyle is powerful medicine. The mix of six works together and synergistically, and small daily changes equals long-term healing. Anti-cancer living reminds us that our choices matter. When we combine the six pillars, we give the body what it needs to prevent diseases and support its healing.